Heart failure is a condition where the cardiac output, the forward flow from your heart, goes down. Now, sometimes it's a squeezing problem. We call that systolic heart failure. The heart's no longer squeezing, blood's not going forward. And sometimes it's a relaxation problem. The heart's not relaxing enough. So even though it's squeezing well, but because it doesn't relax very much, it doesn't get enough blood in it, so it squeezes out just a little bit of blood, and you end up with a decreased cardiac output or a lack of forward flow. Now, there are all kinds of things we can do for this. We have to rule out, plugged up arteries or what's called ischemic heart disease. We can do, echocardiograms. We can do cardiac angiography. We have to look at all of the possible conditions that may have caused this and then attack each one of them as needed. If you have blocked arteries, we can open them up. If there's no blocked arteries, we put you on medications. There are about 4 or 5 medications that we have in our arsenal now that we can use to help reduce and eliminate heart failure symptoms. Now, some people, even despite all of our efforts, their heart failure does not improve. There are lots of very advanced techniques. Some of them we've discussed on this channel as well, but some of them include defibrillators. Some of them include things called left ventricular assist devices. Hopefully we never get to that point. The whole point, like I said, is we want to prevent heart disease rather than have to deal with the consequences later. So ask one of our cardiologists or nurse practitioners about heart failure, what type of medications you should be on, what kind of testing you need, how to even know if you have this or not. These symptoms are generally, you get progressively more and more short of breath and progressively more and more fatigued. If this sounds like you, please call us and try to get in right away. We'll get you in as soon as possible. If you're getting more short of breath and more fatigued over time, this is something that you may have. It is called heart failure. And I know it sounds scary. It's like, oh my God, heart failure, what's going on? But it's definitely something we can easily treat and handle and hopefully get you cured and feeling a whole lot better.